The Iowa Department of Public Health has only had so many tests available, and so because of those limitations and resources, they've tried to target their tests towards people that are the highest risk. And so that would include people with other illnesses or healthcare workers or people that live in nursing facilities or other group home settings. And so for people that qualify for that test, we've been sending outpatient tests to the Iowa Department of Public Health. And we've been able to send swabs to a local commercial lab. So over the course of the last couple months, we have gotten more swabs, and it does seem like testing has become quicker. So instead of 2 weeks, it's now approaching something like 5 days, which is more on par with the Iowa Department of Public Health turnaround time. And it does vary with the number of tests that these places are doing. But I do think that we are seeing an increase in the number of tests that are being done in our outpatient clinics because of those changes that have happened. Really until the last week or two, we really weren't seeing a lot of patients coming into the hospitals, though. And with this illness, in general, it seems like about 20% of people that get diagnosed do end up coming into the hospital needing extra support. And so I would sort of infer from the lack of people in the hospital that there really hasn't been a lot of disease in our county. But I think we're starting to see changes now. I think we're starting to see more cases, and I think that's reflected in the number of positive tests we're getting through our outpatient clinics and the number of people that we're seeing in the hospital. The hospital just last week, so what's today? So end of April, finally got our distribution of the same-day test available. So that's a test that we no longer have to send out to another facility, but is one that we can do right at Mary Greeley Medical Center, and we get the result back in about an hour. So that is a huge benefit to the hospital, because when we were having people coming in with illnesses, we would do a test looking for coronavirus, and we would have to assume the patient had it while we waited for that test result to come back. Well, if you have to wait a couple days, then that means a lot of extra gear and protective equipment needs to be used on patients that maybe didn't have coronavirus to begin with. So now that we have a same-day test, using that on patients that are coming into the hospital becomes incredibly valuable for our community, so that we can have enough of our protective gear for our frontline healthcare workers. And we've already seen that we're needing to isolate fewer patients because we know from the get-go, well, this patient doesn't have coronavirus, there's something else causing their illness. So I think that's the way the same-day test is being used right now. And I think as our capacity grows with the same-day testing, my hope is that we'd be able to start doing same-day testing for outpatients as well. For now, though, we're trying to focus that rapid turnaround testing towards people that are in the hospital for that reason.